People today sleep 20% less than they did 100 years ago, and more than 30% suffer from insomnia. Dr. Daniel Blocker, Director of Behavioral Medicine at Pomona Valley Hospital Medical Center, reveals ways to get a good night's sleep.
Insomnia is a consistent inability to feel rested after a period of sleep. And usually it's limited or reduced sleep, 4 hours or less. So as you work with your doctor targeting insomnia, it's important to clarify if the difficulty is falling asleep or staying asleep, because they are two different problems. If you have problems falling asleep, there can be many different reasons for that. One of the first things your doctors will recommend is called sleep hygiene. What that means is they walk you through different steps you can take to make your sleeping environment a better place for sleep. Having your room be cool, limiting to what you do on your bed to only be for sleep or sex. A lot of times we sit in our beds and we stay on our phones, or we read, and that is not helpful. If you are having a hard time sleeping and it's been about 30 minutes, get out of your bed, go somewhere else, read for a bit, and then try to go back to bed. If you have problems staying asleep, this is usually a bigger problem. And there can be a lot of reasons for this that are medically based, including sleep apnea, including restless leg syndrome, among others. If you're having difficulty staying asleep, talk with your doctor, and they may request certain evaluations be done to make sure that those aren't the case, and then we can find other strategies. If you're trying to go to bed and you don't fall asleep till 4 o'clock and you wake up at 6 o'clock, then what I would recommend is delaying the time you go to bed and work it on a scaled pattern. So let's say right now you try to sleep and you fall asleep at 4 a.m. pretty consistently. Then as opposed to you being angry and frustrated that you're not sleeping, laying in bed, tossing and turning, throwing your pillows, don't go to bed until 4 o'clock. Take all the pressure off. The next week, move it to 3:30. The week after, 3 o'clock. The week after, 2:30. The week after, 2 o'clock. What you're doing is you're retraining your body how to sleep. For whatever reason, it got out of whack, and by doing that process, you can help yourself relearn to sleep.
Insomnia can have serious health consequences.
Insomnia can hurt many aspects of your physical and mental health. Not sleeping is important. It's important for doctors to know that because it can mean a whole lot of other things. So by addressing insomnia, hopefully your overall health improves. One thing that is common is a request for medications to create sleep. There's a reason why your doctor may be hesitant to offer a medication to help you sleep. The reason is those medications, while effective initially, work less and less over time, requiring more and more, which eventually results in a reliance on that substance and an unnatural sleep pattern. So we usually discourage that means and try to encourage the sleep hygiene strategies as a way to address sleep and to help you sleep.